Dr. Jenna from Heart-Based Medicine. This is the next part of my series on menopause. I want to talk about what can happen as you're going through that perimenopausal time. Now, perimenopause can start anywhere from 10 years before menopause occurs, averages about 7.5 years, and the symptoms can start to be gradual. Some women don't actually notice them until they get more severe and they start going, oh, what is actually really coming on here? Now, again, like I said, every woman has her own journey through menopause, and some women have a very easy journey through, and some women may have a very difficult journey through, but everyone is individual. So let's stop comparing. Let's stop telling each other what it might be like. We do that with birth. We scare women about birth. So let's not do that about menopause as well. Let's change that custom that we do to other women. Let's actually uplift them. Let's actually champion them through their change of life and through this, again, natural phase of a woman's life. So what happens as we start going into perimenopause, or using that word menopause to encompass the whole journey? Our ovaries start to fail. So normally what happens is we have a surge of estrogen in our body that occurs after our period. This signals our pituitary gland to release FSH, follicle stimulating hormone, which tells the follicle to start to mature. Then it will have signaled pituitary to release follicle stimulating hormone and luteinizing hormone, which then tells that follicle to release. The estrogen drops, you produce an egg. Usually that's about day 14 if you have a 28-day cycle. And then your estrogen rises again, not quite the amount that it does during that first stage, and your progesterone rises. That progesterone is what then creates the lining of the uterus. When that progesterone and estrogen falls is when you have your period. If you get pregnant, obviously that progesterone stays high, and that continues the pregnancy on for you. So as we start going into that perimenopausal time, we don't have as many follicles. Every time that the body's stimulating us to make a follicle, we may not. So we have that anovulatory cycle, meaning we didn't ovulate, or the hormones aren't rising quite as much as they used to. So then we may get symptoms from this. Again, some women don't, so don't have those expectations. But symptoms that may occur, first ones may be sleep issues. So you start to notice you're just not getting as good enough sleep. Now, for women who have their babies late in life, this may coincide to those times where you're still breastfeeding or have kids that are waking up a lot during the night, so it can be a bit confusing. For other women who had their children earlier, they start just noticing they're just not sleeping as well as they used to. Of course, many things affect sleep: stress, thyroid, mood, all those things can affect sleep, but that might be one of the first things you might notice. Also, we might notice mood. So a lot of women have those PMS or PMTT or PMDD. We have all sorts of letters now to describe it, but those times that week before their period, when the progesterone's falling, when they get those symptoms either of anger, of rage, of sadness, of depression. So when we don't have that ovulation occur, we don't have the progesterone surge, so those symptoms can become sooner and become stronger. So we might notice that we get tearful earlier, or we're tearful for 2 weeks of the cycle, or even more than that. We might be really sad for no reason. I used to cry at toilet paper commercials. So those things can happen, but also the anger can happen. We just get irritable for no reason. A lot of women come in and say to me, I'm just so irritable with the kids. I just don't know how to handle it. Now, again, many things can cause those: stress, marital issues, lack of sleep itself, thyroid, other things. But it is one of those things can happen in that perimenopausal time. Other things we can notice: hot flushes. Those usually come a little bit later, but again, if we have that anovulatory cycle, we may not have that estrogen surge, so we get those hot flushes because the estrogen's not there, and then they disappear again because we ovulated again, and it's a little confusing. Am I or am I not in menopause? So you may get some hot flushes, mood swings, sleep issues. Other things that can happen during that time: dry skin, dry vagina, painful intercourse, lack of sexual drive, because as well as our estrogen and progesterone falling, also our testosterone falls. So we might have a decrease in sex drive. We can have constipation, palpitations. We can have muscle pains. A lot of people nowadays are talking about the gluteal tendinopathy that happens with menopause, but other muscle aches and joint pains can occur. We can get high blood pressure. A lot of women's blood pressure goes up as they're going through menopause. They get put on blood pressure medications and then never get taken off after they go through menopause, and they actually probably don't need it anymore. We can get chest pains. So many things can happen, and again, they can mimic many other things. So it's important to get any of those symptoms checked out with your GP, nurse practitioner, whoever you see for your health care, your naturopath, your homeopath. So that journey through menopause can happen in many, many different ways. Some women, what happens is their periods just stop one day and they never have another one. Other women, their periods actually get closer and closer together. Other women, they get further and further apart. Some women, they get lighter and lighter and lighter. Some women, they get heavier and heavier and heavier. All those things can be normal. None of them mean anything good or bad. They're just different ways to go through menopause. Usually you can have a period, you can skip for 3 months, have another one. You can even skip for 12 months and then actually have a period. If it's been just a 12-month pause, that's normal. But if it goes more than 12 months and you have a period, again, that's something that should get checked out by your GP or your gynecologist, your naturopath, whoever you use as your healthcare provider. Again, the message I want to give is that menopause is natural, it's normal, but we can have symptoms, and there are many things we can do to help those symptoms if we do have them. Stay tuned for the next part, and we'll talk about different treatments.